Imagine taking a pill that has no real medicine in it, yet somehow you start feeling better. Sounds unbelievable, right? But what if I told you this happens all the time and it's backed by science? Today, we are diving into one of the most fascinating mysteries in medicine, which is the placebo effect. How can a sugar pill, a fake injection, or even a pretend surgery trigger real healing? Can your mind actually heal your body? Please stay with me to the end because you'll be shocked at how powerful your brain truly is. I am Esther, a nurse passionate about health education. If you're interested in how the mind and body work together, hit that subscribe button and let's get into it. The placebo effect happens when a person experiences real physical or mental improvement despite receiving a fake treatment. This could be a sugar pill, a saline injection, or even a completely fake surgery. Sounds weird, right? But it's been tested in thousands of medical studies. In fact, in some drug trials, up to 50% of people taking a placebo report feeling better just because they believe they are getting real medicine. But here is where it gets even weirder. The placebo effect doesn't trick the mind, it actually triggers real physical changes in the body. In 2002, scientists performed a study on people with knee pain. Some patients got real surgeries, others got a completely fake surgery. Doctors simply made an incision, pretended to operate, then stitch them back up. The patients who got fake surgery reported the same level of pain relief as those who had real surgery. Did you know the color of a pill affects how well it works as well? In studies, red pills were found to work better for pain relief, while blue pills were better for anxiety, and yellow pills are more effective for antidepressants. But here is the thing. The actual drug inside didn't change. Our mind simply associates colors with effects. It's all about what our brains expect. If you're unsure about this, just ask nurses who dispense medications to patients. I used to have someone I was looking after who swore that white Zopiclone helped her sleep. But whenever the pharmacy brought a different color, she would complain that it didn't work. The moment she got the white pills again, she slept fine. Nothing changed chemically. It was all in her perception. Another example from my time as a school nurse highlights how powerful our perception of medication can be. Many children would come to me complaining of pain and would insist on something stronger than paracetamol, especially when they're in so much pain, believing it wouldn't be effective. So we gave them a different brand of paracetamol that looked different from what they were used to. And yes, you guessed right. They felt relieved just because it looked different, even though the medication was the same. It's not just kids either. I personally believe that paracetamol helps me sleep. Every time I take it, I seem to sleep better. The truth is, there's no scientific reason for paracetamol to make me sleep more, but my brain associates it with relaxation and rest. This just goes to show that sometimes the expectation of relief is enough to create real relief, even if the treatment is exactly the same. Now, this one is mind blowing. In a study on Parkinson's disease, patients were given a placebo, but their brains actually increased dopamine production, the same chemical that real medication is supposed to boost. The placebo effect isn't just something we see in clinical trials, it also happens in everyday life. Think about how many times you've had someone say, I feel better just because I believe it will work. People who try home remedies or alternative treatments often experience this phenomenon as well. When they believe a certain treatment or product will help, their symptoms may improve simply because they have the belief that it will. So, how does this even work? How can a fake treatment cause real changes in the body? Here is what is happening in your brain. Your brain releases endorphins. They are natural painkillers like morphine, but these ones are made by your body. 2. Meditation triggers real reactions. If you believe a treatment works, Your brain sends signals to actually reduce pain, lower stress, or improve symptoms. Another is conditioning plays a role. If you've taken medicine before, your brain has learned to expect healing when you swallow a pill, even if it's fake. In other words, belief changes biology. Interestingly, there are ways to enhance the placebo effect. One of the most powerful factors is doctor-patient interaction. Studies have shown that when a doctor expresses confidence in a treatment, even if it's a placebo, the patient is more likely to experience improvement. For example, if a doctor says this treatment has worked for many people and I believe it will help you, the patient is more likely to experience positive effects, even if the treatment itself is inactive. The doctor's belief in the treatment can influence the patient's belief as well, amplifying the placebo effect. This is why the doctor-patient relationship is so crucial. The trust and reassurance in those words can set off a cascade of positive expectations, which may enhance the treatment effectiveness, even if it's just a placebo. A caring, confident recommendation can transform the patient's outlook and in some cases lead to better outcomes. While the placebo effect can be powerful, it does raise important ethical questions. Should doctors give placebos to their patients, especially when they know the treatment has no active ingredients? Many argue that it's wrong to deceive patients, even if it's for their benefits. The ethical debate continues, but one thing is clear. The placebo effect shows how much our thoughts, beliefs, and expectation influence our health. It's a reminder of the mind's incredible power. There is a flip side to all this, and this is called the nocebo effect. Just like positive expectation can improve health, negative expectation can also cause real harm. In one study, patients were warned they might get headaches from a new drug. But here is the catch. They weren't actually given the drug, just a placebo, yet many of them still got headaches. This proves that the mind isn't just powerful in healing, it can also create symptoms out of pure belief. Now, let's switch gears and talk about something that connects the mind-body relationship to a medical procedure, which is spinal anesthesia. While spinal anesthesia is a legitimate medical treatment that has real effects, it too can be influenced by expectation and belief, much like the placebo effect, or this one I'll say nocebo effect. Spinal anesthesia is a type of regional anesthesia where an anesthetic is injected into the fluid around the spinal cord to block pain, typically for surgeries on the lower body. These techniques allows patients to stay awake during surgery while still being pain-free, which is ideal for surgeries like cesarean sections or hip replacements. The procedure actually involves injecting a local anesthetic into the subarachnoid space in the lower back, numbing the lower half of the body. It's a great alternative to general anesthesia because it's safer for patients who have certain health conditions and also allows for faster recovery. One of the benefits of spinal anesthesia is that it allows patients to remain conscious during the surgery, which is often preferred for those undergoing cesarean sections, for example, because it's safer for both the mother and baby compared to general anesthesia. It also has fewer side effects compared to general anesthesia, such as nausea and confusion. Spinal anesthesia is generally very safe, but spinal anesthesia isn't without its potential side effects as well. One common issue is that patients might experience posterior puncture headaches, also known as spinal headaches. This can happen if the needle punctures the dura mater and causes cerebrospinal fluid to leak out. The resulting periodic change can cause a headache, which worsens when someone is sitting or standing up. It's fascinating how something so physical or minor can cause such a real and uncomfortable headache. But it's all about the prior changes in the brain. These headaches usually resolve on their own, but in some cases, a blood patch is used to seal the hole and relieve the symptoms. But here's the connection to the nocebo effect. Just like how patients believe in a treatment can influence how they feel, a person's fear or expectation of pain during spinal anesthesia can actually impact their experience as well. If someone expects the procedure to be painful or to be unsuccessful, they may experience more anxiety during that period, which can worsen their perception of pain because it's all in their brain. Another way where the mind comes into play as regards the spinal anesthesia is that many people who experience spinal headaches feel much better when lying flat. So this is because lying down helps reduce the pressure change in the brain and allows the cerebrospinal fluid to return to normal levels. However, a common misconception among some patients, especially pregnant women, is that if they are going for cesarean section, they don't have to leave their head, because if they leave their head too quickly, they will suffer from these headaches for life. Many women, especially those who haven't experienced cerebrospinal fluid leakage, mistakenly believe that they will develop chronic headaches if they move too much after the surgery. In fact, some patients who have had spinal anesthesia continue to report headaches and migraines even years later, mistakenly attributing them to the anesthesia simply because of the strong belief that the procedure caused those issues. So this is a great example of the nocebo effect. Their fear of having a lifetime of headaches because of simple movement can actually worsen their symptoms or create new ones. Their belief that lifting their head will cause long-term pain is what ends up affecting them. This is an example of the nocebo effect at work, where negative expectations lead to physical symptoms. So, does this mean your mind can heal you completely? Can belief alone cure diseases? Meditation and healing. Studies shows mindfulness and meditation can lower stress, blood pressure, and even the pain levels. Psychosomatic illness. Emotional trauma and stress can manifest as real physical symptoms like headaches, stomach issues, or chronic pain. Positive thinking in medicine. Research suggests that optimistic patients recover faster from illnesses and surgeries. While the placebo effect is not a cure, all it shows is that our minds plays a major role in health. This all comes down to the mind-body connection. When we expect a treatment to work, our brain releases chemicals like dopamine and endorphins that help reduce pain and improve mood. Conversely, negative expectations can trigger the release of stress hormones like cortisol, exacerbating pain and discomfort. This interplay highlights the importance of maintaining a positive mindset, especially when facing health challenges. While belief alone isn't enough for every condition, it can certainly enhance the effect of conventional treatment. Maybe the key to better health isn't just medicine, but also how we think and believe. Of course, the placebo effect has its limits. It doesn't work for everything. For instance, serious diseases like cancer or infections, they definitely need real medical treatment. It is important to note that while the placebo effect is fascinating and can lead to significant improvement in some cases, it's not a cure-all. In many situations, especially where serious or life-threatening conditions are involved, belief alone isn't enough to replace effective evidence-based treatment. The placebo effect works best when used alongside real medical care, not a substitute for it. And also, it doesn't always work for everyone. And lastly, some people use this placebo effect to scam others with fake cures. So while your mind is powerful, we still need real medicine for life-threatening conditions. So what have we learned today? The placebo effect is real and it's been proven by science. The mind can trigger real physical healing, but it has its limits. Thirdly, the way we think and believe can also impact our health more than we realize. So whether it's a sugar pill, a fake surgery, or a medical procedure like spinal anesthesia, we can see how powerful belief and expectation are. Our minds shape our experiences, influencing how we feel physically and emotionally. The placebo effect and the nocebo effect shows us that our thoughts can be a powerful force in shaping our health outcomes. I hope this video has helped you understand how both the placebo and nocebo effects work and how they tie into real life experiences, like my examples with zopiclone and paracetamol, and even the experiences of patients with spinal anesthesia. Remember that while belief can enhance healing, it's not a replacement for proper medical treatment, especially in serious cases. Always follow your healthcare provider's advice and combine positive thinking with effective care. Now, I want to hear from you. Have you ever experienced the placebo effect? Do you think that the mind is more powerful than we give it credit for? Let me know in the comments. And lastly, if you found this video helpful or you enjoyed this video, Please like, share, and subscribe to the channel for more content on health, wellness, and the mind-body connection. And leave me a comment below with any questions or experiences you've had with the placebo effect or spinal anesthesia. Thanks for watching, and I'll see you in the next video.